Well, let me ask you, the change from ACEs to PACEs connection. How many people like it and how many people don't? So the people who like it, why don't you raise your hands or thumbs are up? And great. And is there anybody who doesn't? No. Would you tell me if you didn't? So I think they're mostly people have liked it, and I don't know if you read that. Are you all members of ACES, PACES? It's going to take me a little while. PACES Connection. Yeah, and if you aren't, please join. We'd love to have you. We've been thinking about this for a while, and I think it definitely was Christy and Bob's research that was published in 2019 that had us starting to figure out, okay, how do we do this? Because we'd always included resilience in our 5 parts of ACEs science at that time, but it wasn't as emphasized as it could have been. And I didn't want to do just the strengthening families route, because I had seen that if you just do positive and you don't do the entire look at what's happening to people as they're growing up, you're losing something. And so it's got to be this combination. When we were first starting to work with this, we have this, the 3 realms of ACEs science, and we were going to just do a flip side of that and say 3 realms of PCEs. And then we realized, no, that's not accurate. It's got to be combined. And so we're working on that infographic right now, is how do you combine that so that it reflects what we experience throughout our lives. I'm going to go ahead and just do a little overview of PACEs connection. And why I decided to do this was, we developed first ACEs connection, and we based it on Marshall Ganz's social movement. Do anybody know who Marshall Ganz is? So he's kind of one of my guiding lights in how we developed ACEs connection and now PACEs connection. He's at Harvard Kennedy School, and he worked with Cesar Chavez in the social movement in the Farm Workers Union, and he learned a lot about. He was sort of the behind the scenes guy and trying to figure out, well, how is this social movement going to work? How's it going to be most effective? And he had four things that he says are important for any movement, and he added one not too long ago. And so the 4 that were in place were shared stories, structure, strategy, and action. And then the last one he just added was relationships, which, you can't do anything without relationships. And we have, that's kind of been our North Star, is that approach. And so I was always cognizant of what is the structure behind ACEs connection and now PACEs connection. I've integrated all these things, and I can tell you how all that works. So what we're doing is echoed in every community across the country that is integrating PACEs science, or can be. And so far I think we've been pretty effective in what we're doing, and I want to keep being effective. And the way we do that is by following people who have done this before in a way, and so that's what we're doing with Marshall Ganz, and then also listening to our community, because we actually have had communities on PACEs Connection almost since the beginning, but they've changed over time, mainly because of what everybody in the community has said they wanted or didn't want anymore. All right, so one of the things that we saw at the beginning of the pandemic was that people were saying, I wish we could get back to normal. And we all thought, our normal wasn't such a great thing for most people. So it's really better if we create a better normal. And so that's kind of what we're all about. We support communities to accelerate pace of science. And the reason that we do this is that social movements tend to move kind of slowly. As you all know, any movement that's come along, whether it's women's rights or civil rights or farm workers union or whatever, it's taken a really long time. Well, we don't have that time to waste. We have climate change breathing down our necks, and besides all the other issues that we're dealing with, and that's just going to make life a lot tougher. So we want to make sure that people have all this information and are starting to use it in a very effective way. And so among all of us, we can do that. And the more people we can get involved in this, the better. The good news about all this is that we already have lots of examples about how people have used this science to solve their most intractable problems. And I'm going to list some of those now. And by the way, we are just over 51,000. It's grown pretty quickly, so that's a good thing. So many of the ways that we have already put this into effect is mostly in different sectors of our society. And there are lots of schools that now that have integrated pace of science that now no longer need to expel or suspend students at all. And the test scores and grades and graduation rates have increased a lot. It's pretty remarkable. This has happened in a very short space of time, since probably about 2012, when a lot of people started paying attention to what was happening in schools, and especially the schools that were like Lincoln High School in Walla Walla, Washington, which was one of the first to integrate this, and in a very difficult high school, meaning that very challenging, where there weren't a lot of resources for the kids that were in this alternative high school. And they really showed what a difference it could all make. So they dropped their suspension rate. I think it was 89% the first year. And after 3 years, they didn't need to expel students at all, or suspend them. So now half of schools in the country know about pace of science. And that's, just knowing about it is the beginning to starting to do something about it. So that's a pretty good thing. The other examples are, there was a health clinic in Pueblo, Colorado that integrated pace of science and saw a 30% drop in visits to the emergency room and an uptake in the people who kept their appointments, and that just shows that they were developing relationships with people there, and they were trusting the clinic. In San Diego, during the first year of a juvenile detention facility that was built to be trauma informed from the ground up, they had no violent incidents, 0 in the first year they were open. It's pretty remarkable. Pediatricians now can identify who integrate ACEs science, beyond the screening, but actually integrate it into their cognizance, and they educate their parents about it. What they found is they can detect developmental problems and identify family violence years earlier than they would normally have. For those of you who know about Safe Babies courts, their numbers continue to impress folks. because after 1 year of being involved, after 1 year after a family leaves Safe Babies courts, they still saw a 99% of the kids suffering no further abuse. That's pretty remarkable. In Plymouth County, Massachusetts, they were actually the first one to start Handle with Care, which is a program that coordinates police, law enforcement with schools so that they can identify kids who have witnessed domestic violence, or that they have been at a place where the police have been called in the middle of the night or in the 24 hours previous. And that's usually traumatic for kids. And so the school is there to help the kids. So what they did, they have also done trauma-informed schools in that community. But what they did was, when the opioid epidemic was taking a big toll in their county, they started integrating law enforcement, social services, the healthcare community, and they had a program where if someone was hospitalized and then went home, the next day they would send out a plainclothes police officer who's trained in PACES science, and a social worker, and say, we have a place for you at this rehab facility, which is trauma-informed, and we'd be glad to take you there right now if you would like, and we'd love to buy you dinner along the way. And that's about as trauma-informed as you can get in helping people. And it made a difference. In the first year that they were putting this into effect, opioid deaths in that county dropped 26%, while in the surrounding counties that didn't do this, the death rates increased 84%. So it makes a huge difference. This knowledge makes the biggest difference in this kind of work. A batterer intervention program in Bakersfield, California, dropped their recidivism rate from 60% to 1%. You can wipe out domestic violence in a community in 5 years if you take this approach. Because the domestic violence community hasn't paid a lot of attention to batterers. And we know that batterers and victims come from the same soup. Why shouldn't they have the same kind of approach in their services? What I forgot to also say about Plymouth County is that every sheriff department and every deputy sheriff in Plymouth County has been educated about ACEs science. It's this knowledge that really makes the difference. It can do so in organizations too. The Wisconsin Economic Development Corporation found that staff turnover declined from 21% to 10% in a year. In a social service organization that integrated this, they saw that their health insurance rates dropped 5% because everybody was so healthy. Some of the work that Laura Porter was doing in Washington State saw that, for example, in Cowlitz County, Washington, when they were implementing this approach there in the communities, youth suicide and suicide attempts dropped to 98%. So there are a lot of good programs out there, and I think by integrating PACES science and what people are doing, people will be able to achieve the kind of goals that we're hoping that we achieve. So PACES Connection now has more than 400 communities. I think about 30 of these are interest-based and the rest are geographic-based, and we keep growing these. You can, communities that want to start an initiative in their community and want a place on PACES Connection can do so for free. And what we were starting to see about 4 years ago was that there were some communities that were mature and had done quite a bit of work, but they were hitting a wall. And so we wanted to find out what we could do to help them. And where they were hitting a wall was that they were unable to measure their progress in any kind of effective way. So we messed around with how can we do that, and what else. We asked what else that they needed. So we developed the PACES Connection Cooperative of Communities, which we actually launched just before COVID hit. And then we had to take a break because COVID. And so we relaunched in January. And so we have 4 communities that are part of the cooperative, 4 affiliates. And one of those is Fresno County in California, and where Brian Semsem is. So we have, I think it's 9 now in the pipeline who are on their way to becoming part of this. And hold a second, let me just see if this is okay. So this is how this works. The cooperative is it's affiliate driven. So what we mean by that is that when an affiliate joins, they actually are the ones who are driving what they want to do in a very hands-on way. The initiatives are in cities, counties, regions, and will soon be in states and nations. The communities who are ready, because we don't want communities to join until they are ready, because we don't want to waste anybody's time and we don't want to take anybody's money needlessly. We charge $5,000 a year for this. That we hope will cover our costs in the long run. And we also didn't want to make it so onerous that that communities couldn't join. And our long-term goal is to get enough communities in the cooperative that the cooperative can actually fund other communities that are starting this. That is our plan, and we're here for the duration. Not only do we want to make this, we know that this transition is going to take 10, 20, 30, 40 years. If every organization in every community in the country is going to become trauma-informed and integrate PACES science. And so we want to make sure that we don't want to waste any time, but on the other hand, we know this is a big lift for a lot of communities, and we want this to keep going. So that is part of the structure piece of this, is that we, in building social movements, that this is what you're seeing kind of behind the curtain, in how we're organizing all this. So communities get the Community Resilience Tracker, which I'll show you here pretty quickly. Diversity, equity, and inclusion coaching. And this DEI approach integrates DEI with PACES science. And there's not a lot of organizations that are doing that, but we know that that's critical. We also have virtual think tanks and webinars. For those communities who need it, we provide a physical pass-through service. Leadership support is very important, because what we're teaching is distributed networking technology. All these networks that are, we're moving from an environment where organizations were very hierarchical, and now everything's getting flattened and it's moving into networks. And there's a very different way of managing networks and being a leader of those networks. And so that's what we're not only have we learned this over the last few years, but there are actually a lot of people out there who are working on this topic, and we have some very good advisors who are helping us in that and who will teach that. And we'll also be developing a jobs bank. So at the heart of this is the Community Resilience Tracker. As I said, communities were having a hard time figuring out how to measure their progress, and you've got to be able to measure your progress as you're doing this work so that you can make course corrections, so you can figure out how to do things differently, not go down the wrong path. So the resilience tracker that I'm going to show you monitors the community's progress by tracking milestones that individual organizations achieve on their journey to becoming trauma informed. And it helps communities define their successes with data so that you can take that to your city council or to a funder and say, look, this is the progress we've made. If you give us this X amount of money, we can do, make 10 more schools trauma informed, which will, in the long run, drop juvenile crime as well as juvenile visits to, or youth visits to emergency rooms. So there's a lot of ways that you can use this information. So here's Fresno's tracker. And this is the page that, and you can see this on there, the Fresno County, California Trauma and Resilience Network on PACE's Connection. You can find and see their tracker there. So what we've done is we've applied this. So in the right hand under, can you see the list of sectors and subsectors on the right? Yes, you can. Okay, good. There's some on the left, but there's a color coded on the right. And this is all of, I think it's 47 organizations now that are in the process of doing their, filling out their milestones and putting them on this map, which I'll show you in a second. But here's just at a glance of which sectors are more involved in this movement in Fresno County. And so you can see most of it is health. There is community service organizations, and then the third is education. There's really not much for media or political organizations or college yet, or business. So you can see where the gaps are at a glance and how you could fill this in. Okay, here's the map. So the counties are color coded to the burden of ACEs, of 4 or more ACEs in each county. And on the right, you can see the sectors, and on the left, you can see the attributes of organizations to display. That's just the milestones. That's data speak for milestones. And you can see that there's 11. We've actually added 3 more because we figured that we did have a question that included diversity, equity, and inclusion, but we thought that we needed to call it out. So we've done that. So we have 14 questions now. So the dots on the map are color coded to sector and size coded to number of milestones that a community has completed. And here's a close-up, a zoom in of that. And you can see all the dots. They're different sizes and different colors. And if you click on the county, you'll see that Fresno, the percent of people in Fresno County with 4 or more ACEs is 18%. And if you click on one of the dots, you'll get Resiliency Center of Fresno, how many milestones they've completed on the tracker, and what subsector and sector they're in. You can select for different sizes of dots or different, essentially different milestones. And I should tell you that the milestones range from, has anybody in the organization learned about PACES science, to more complex things like, is leadership completely on board? Have you integrated PACES science into your HR practices? It's not meant to suffice an organization to use this to do an assessment of what they're doing in their own trauma-informed work, but it's good enough for the community. And we have links to a lot of different kinds of organizational self-assessment for organizations that are just getting into this and need this. Now, this is a great way of, as I said before, not only learning where your gaps are, but it's also a way that when an organization comes into this and starts going down the journey of completing all their milestones, if they get stuck on like milestone number 3 or milestone number 4, they can go to some other organization here just by going to the map and contacting them and saying, you know, we're having difficulty on this one, can you help us out? So that's just more about that. So that's the milestones piece. I can say this is amazing because it's the person behind all this is our data guru, Samantha Sanjanito, and she's actually the one who came up with all this. So it's one thing to learn about how your community is making changes, but it's even better if you can get some outcome data. And so that's what the sector pages are all about. So say you want to take a deep dive into education or into the faith-based community or into health or law enforcement, you know, whatever, you have the ability to do that. And because you want to start measuring, is integrating this knowledge into organizations actually making a difference? And so you can do this with the sector pages. And I'm going to go kind of quickly through this because Brian can tell you a little bit more about their approach to the map as well as what they're doing in the sector. So the point of this is to look at, say, in this case, what's chronic absenteeism doing, and this is looking at Northeast Tennessee. And you can start looking at and seeing where in a particular school district, where chronic absenteeism is the highest. And that's, it's correlated with ACEs science. And so you can kind of say, maybe our next move should be to, you know, these are the trauma-informed schools that are making, you know, changes in learning about PACES science, but maybe our next school should be over here where there's more need. And you can use this the same way. The other cool thing you can do is we use chronic absenteeism because that's every school district in the country uses that as a measuring tool, but you can add other things. So if you know that your schools are practicing restorative justice, if you're creating cross-sector partnerships, if you're teaching mindfulness with students, you can start measuring those things as well, just, you know, for your own knowledge, so that after you start seeing progress, you can see, you know, eventually in comparing schools, you can say, well, these schools that have been teaching mindfulness are a little bit ahead of the schools that aren't. Maybe we should try teaching that as well. So here's just another way of looking at that information. And the benefits, well, actually, I'm going to end here. because there you go. The reason I'm going to end here is because Brian can tell you the benefits, and I'm not twisting his arm. He came to this voluntarily, thought it was a good idea for his community. But Brian, if you would, and what I said at the beginning was that, you know, I sort of gave him a kind of under the hood look at PACE's connection. You know, why we use structure and strategy and relationships and shared stories and action. You know, that's kind of what's behind it, but you're doing it. So I'll turn it over to you. So this is Brian Semsem. He's with Fresno. He's just an amazing person. Brian, why don't you tell folks a little bit about your journey?
Sure. So first of all, Jane, thank you for the invitation. I apologize for getting here late. I was actually, as part of our Fresno County has been awarded an ACES Aware Initiative grant. And so I was in a training and I literally jumped out of one and into another one, this meeting here. So we're actually delivering everything that Jane is talking about as part of building our capacity and taking it to the next level. And part of that engagement is the fact that we're connecting and building relationships. So let me kind of take a step back and just kind of tell you a little bit about how I got involved in this. As a pastor working in the community, I was engaging a population without the information and understanding of ACEs. And so that started my journey back in 2010. And then around 2017, I first learned about ACEs and didn't realize that the past 7 years I was experiencing supporting families and communities who have been highly impacted by ACEs. And so when I became aware of that, I began to seek out everything I could learn to help better equip myself to be able to meet the needs of the congregants and the community I was serving. And that's what led me to ACEs Connection, PACES. And that's where I began to really just dive deeper into this journey. And it truly is a journey. I tell folks it's not a one and done. And trauma informed is more about who you are, not what you do. And that's a pivotal shift. And so as we begin to look at that, I was part of a community organization's work here in Fresno called Every Neighborhood Partnership. And Artie Padilla was the executive director. And when I found out about ACEs, I asked him, and this had been around 2014, I think, about that time when we just first started asking. And I said, surely if somebody in our community is doing something around this information, Artie would know. And the thing was, nobody was doing anything collectively. There was a lot of siloing going on. We had a lot of initiatives going on in Fresno for about a decade. And ACEs and resilience was the cross-cutting thread that connected the issues and the answers, but nobody made that connection, right? So whether it was our education initiatives with C2C, our health initiatives, all of those things were kind of siloed. And as we begin to meet other communities doing this work, we recognized that ACEs Connection provided an opportunity to connect with a larger network throughout California and then around the world, really. And so that's what started us. So we started the Fresno County Trauma and Resiliency Network, following the model that PACES Connection has set up, and we used their resources. And I think what we did, I think uniquely different, was that we camped out for about 3 years at building deep relationships across sector. And so we had monthly listening conversations and learning conversations to hear about what different sectors and different organizations were doing related to ACEs and trauma-informed practices. We invited ACEs Connection staff to come and share what they were learning and share it with our folks. And then we launched the Trauma and Resiliency Network as a result of like, yes, this is really what we need for our community. And then we aggressively built those relationships and cross-sector partners and began to be more intentional. And over the last 2 years, after building those deep relationships, which is a trauma-informed principle, right? And so we were living it out in application, not just information, right? So one of the things that we talk about that's really important is knowledge is essential, but not sufficient for transformative change, right? It is absolutely essential, but it's not enough. Insight and deep relationships that foster a sense of love, safety, and connection and community is what we like to say is the secret sauce of this work, right? And so that's what we did. And so then the last 2 years, the year just before COVID, we then moved into the direct work and we started to deliver trauma-informed training and presentations. And we actually built our capacity to deliver trauma-informed training using the Community Resiliency Initiative's material. And we had 70 trainers in Fresno County go through a training. We brought CRI out to California, and we provided that as part of our service as a network for free to our partners so that we could build our capacity to continue to deliver this. And ultimately what we wanted, we targeted those CBOs that were at ground zero in the neighborhoods. One of the things that we identified was that the service sectors were having access to this material and this life-saving information, but it wasn't getting into the neighborhoods and wasn't getting down to the folks who could benefit from it the most. And so that's what we started to do, is build the capacity to deliver it at the neighborhood level. And then COVID happened. So we had just finished that capacity building and we were ready to launch 2020 with getting into the neighborhoods. But COVID had a different idea. And so right around April, May, June was a kind of a pause. And then we found our resilience and we said, we're just going to keep doing this work. And we pivoted to online sessions. ACEs Aware provided an opportunity and we're back in the saddle. We partnered with PACES Connection. We got on the milestone trackers because we recognized that collecting data and information to inform our practice and identify the needs, the felt needs, and where our strengths were was vital. And so we did our first pass with the broad 11 milestones, which I understand now is 14. And then as a matter of fact, I'm waiting to see if this meeting gets started because we have ACES Connection staff that's going to be on our network call. So that's another call I have going on at 12, but there's some other folks leading that. But they're going to be diving into the sector survey questions. So we were able to take the question bank that PACES Connection had that were kind of some typical types of questions for those specific sectors. And then we brought it to our team, our network, and we asked which of these questions do we want to uniquely craft to meet our community needs? What other questions are missing that we want to add? And we had a group of folks work on that for a couple of weeks, sent it back to PACES, and now we're following up and finalizing what that sector survey is going to look like, and then we'll be ready to launch that in a couple of weeks. So that's kind of just a quick, and Jane, I can keep talking, so I'm going to stop here.
So there's a question in the materials that you can get for this session. There's the milestones tracker that you can download. There's also a couple, there's this PowerPoint and just some information about the co-op. Brian, can you tell us a little bit about, for the sector survey, which sector did you choose?
Yeah, so you looked at, so we wanted to do them all, but and that's just kind of like, that's my area of growth. We just want to get it all done, right? So I think, Jane, you identified the health sector, our service sector, and then I think the third one was
Education.
Education. So those are the sectors that we started with. And especially the health sector really aligned with the ACEs Aware grant that here in California that we gained access to. And so We had individuals that are part of our network from those sectors come together in a focus group, and we met several weeks, and we just went question by question and contextualized them to our community. And we had those sector partners give that direct feedback. So we had a couple people from education, a couple people from the health sector, and then we had them kind of give that sector specific lens to it. And then we took as a collective group, a step back, and then universally we said, what information coming from these sectors are relevant to the larger scope of the work that we're doing in our community. And then that was the process by which we went through to get our draft of those unique questions. And then and what was great, I really appreciated Samantha's feedback to us. She said, really think about not the question as it's formulated, but what information you want to get to. She says, we'll formulate the question in such a way to get at it. We want you to really think deeply about, what do you need to know? What do you want to know? So that's what our focus group was about. It's like, okay, not so much the languaging and formation of the question. What do we need to know? And so this meeting today with Jane, I forget, is it Marianne?
Yeah, Marianne.
Yeah, so that meeting today is to kind of help them now formulate the questions, right? So ACES Connection, their team now is going to take what we're saying we want to know and fine tune it with how do we get that in form of a question to get at that data, right? And so that's the process we'll be going through today. And then we will launch the survey and start to collect that data. And then once we get that data in, we start that process over again because we've been doing some recruiting. So I think we had about 47 respondents the first time we launched the 11 milestone. And since that time, we've been doing some community engagement and reaching to some of those sectors that aren't represented. And we're going to be able to have a second pass at gaining some of that information.
Terrific. It's funny, in each community, there's a, where the ACES, PACES initiative starts, it's always with a different group, and a different level. So, it might be very formal and start with the public health department that kind of controls everything, which we don't recommend. We think that's the kiss of death for any one organization to control anything. But it also might start with juvenile justice. It might, you never know. But using the DEI tool, the diversity, equity, and inclusion tool, that has all the sectors and subsectors on it is pretty useful for that. And it helps you, as I said, identify gaps. And we're always about identifying gaps all along the way, because people get in a comfortable place, and they say, okay, I think, we're really making, good progress here, but that progress can be derailed by other parts of the community. And so you really want to get as a cross sector as possible. And so there are political organizations in there. We all know that this is not a Republican or a Democratic issue. This is a human issue. And we have had, like, for example, in Wisconsin, they started a very ambitious trauma-informed initiative when they had a Republican governor. And it was mainly because of his wife, who was just like, over the moon about this information, but he could see the benefits of it. But ironically, that all went away when a new governor came in who kind of put a political lens on it and didn't continue, even though he had been doing that in the education department, which is separate from the rest of the government in Wisconsin. And so we need to, as Brian has said, we who have a calling to this need to make sure that we're making this as apolitical and as welcoming as possible for everybody. And if we can set that by example, it'll just inspire other people to do that. Will you say a little bit more about it? Because I know what has happened in Fresno. What I thought was very interesting is how you all started from grassroots. And then it was actually the larger organizations that were kind of last to the table so far. And in other communities, it's been the opposite. In fact, they've had to be more conscious of grassroots because they realized that they weren't including them. So
Yeah, so what I could say is that Fresno has been on a trauma-informed path for over a decade. We just didn't have the language to identify it as such. And then we didn't have some of the guiding principles about ensuring that our work doesn't get siloed. So, with Fresno Unified being one of the third largest school district in the state of California, there was a lot of work around social emotional learning taking place, some of the equity issues. And so C2C, Cradle to Career Initiative, was a huge sector that was looking at leadership, right? So they had been meeting for years. And then the children's movement was more at the direct service level of those service sectors that dealt directly with families and children. And what we found there was that there was often a gap between leadership and frontline service providers, and we weren't seeing the kind of collective traction that we were hoping to. So that's where CTC came in. And so I say that because that's why the big people were missing, those big organizations were initially missing, is because they felt like they were already doing good work, right? And they were doing isolated work, and they were doing work that wasn't reaching the collective impact opportunity that we now have because we network that together. And then often those larger institutions and organizations were doing so according to some of the structural systemic issues that are built into the system that are counterintuitive to what we now know is good practice from a trauma-informed lens, right? And so it was good that we didn't start there, because we brought a fresh pair of eyes to some of the equity and inclusion issues that are often missing from those larger conversations, especially from the folks who've been doing it for a while and have that academic lens or various lenses, right? So we started from like, what do the people need, right? And we had partners with other community organizations that were doing some really great work. Hang on just a second. That other meeting's starting. And so the key that I really want to share was that when we started networking the mom and pop organizations that are the community messengers, the trusted individuals, we created a bridging element that would help to navigate some of the challenges that the larger institutions and organizations were having, because they couldn't get that deep connection to the community and the folks who were accessing services, right? And so we reconstituted that grassroots connection, and then we networked. So every neighborhood partnership didn't do a lot of direct service engagement and programming. Our whole piece was networking community stakeholders together and bringing them around local elementary schools to address and meet the felt needs of those local communities. And that's was the idea, every neighborhood partnership. And so then we took that network of community stakeholders that were around those local elementary schools, and that became our starting point for the Trauma Resiliency Network. It was those folks that were in the neighborhoods doing that work. And then we invited, once we got some synergy and some capacity around those players, we invited the big guys. So we built our table, and then we invited them to our table and to have those discussions. Because we didn't always get invited to the table that they were at. So we decided to take an asset-based community development approach. We developed our own table. We brought in the community. We made sure that we accessed their voice, their purpose, and their passion. We began to empower them. And then we invited the other stakeholders. And when they saw that it was needful for their work to have greater impact, we started collaborating, and that's where we're at today.
That's terrific. That's just terrific. One of the things that, remember I said earlier that we do have to watch out for, because you can watch out for, finish your sentence, Jane. We do have to watch out for being inclusive, because it can all go away in a minute. There's a guy named Chuck Price who was at Watauga in Wisconsin. And do you know Chuck, Brian?
Yes, and that was where the community tracker was debuted, where I met him, and it totally changed. Yes, great story.
And then everything went away when he was booted out. He and his deputy director were booted out because they had done a lot of engagement, but it was public health centered, you know, in that department. And they thought they had done a lot of outreach and had everybody on board, but you know, they didn't. They found out from their to their dismay, and so they lost about 8 years of work. And they were the leaders in county public health departments, I think, in the country for the work that they were doing. So it's kind of important to continue doing the outreach. So there is some science behind this that shows that if you have 25% of a community that you're measuring, and they kind of flipped over to, you know, this new way of doing things, that will be, that's good enough. That will get enough traction for it to keep going. But in communities, you have to, I think you have to do that with every sector. That's not been tested out, but it only seems logical to me. And that's sort of what happened in Wapaka. I mean, because if you get all the sectors, and then we have this demographic filter that goes on top of those sectors, so that you can say, well, you know, am I getting, you know, all the different kinds of politics that are going on here? Am I getting all the ethnicities? Am I getting all the faiths? You know, if I'm getting all that, then you have a pretty good idea that you're beginning to build that network. Well, if you build it that way and take a 25% view, then I think you'll probably get the traction, and you'll lessen your risk of having it go away. And we surely don't want this to go away, you know.
And Jane, if I could say something about that, because if you guys if you're not aware of the work that they had some tremendous outcomes in the child welfare system.
Oh, go ahead and say.
Tremendous. I was just blown away at, and so it is heartbreaking to know that kind of transformational system change that they achieved in a 3-year implementation process that was very intentional, that was data driven, but didn't have the cross-sector support necessary to sustain. And I think this goes to advocating for county government agencies, legislative bodies, right? So all of those macros and components that could then support the outcomes and the policies and structures necessary. So what they did was they achieved those amazing outcomes within the limitations of the macro systems, right? That they did it, and that was because of the heart and passion of a leader within an organization that saw fit to ensure that within his scope of practice and with his footprint of influence, ensured that happened, but it wasn't sustainable because there wasn't the larger macro components that were implemented to sustain those kinds of practices and allow that to drive policy and structure. So I just want to share that that's where we're at here in Fresno, is that we have that cross-sector support, but we're still missing the legislative and those other pieces that are really important to sustain that. But we have enough breadth that I think that the sectors that are in our network, we have enough membership within that, that if the leadership and the burden of leading that sector change is not on one agency or organization. It's diversified. And I'm going to share this piece. It is challenged to truly integrate a diverse, a shared leadership structure within this kind of network. I'm in this meeting right now because someone else is running the network meeting over there, right? And so there's a group of probably about 12 folks that are the leadership piece. They're meeting and doing that because the work goes on. It's bigger than one person, one agency, and one organization. And so if I can say anything, build wide and deep.
You know, like we said, this is a 10, 20, 30, 40 year endeavor. And where we're building is to actually change the structure of a community so that we're not so siloed, and that we are helping families and kids and communities get what they need. So for example, you know, I told you that story about Plymouth County. And what's happening there is that what they learned was that every police officer or sheriff's deputy needs to be educated about this. So they've done that. And it's inspired them to say, I'm so glad that we're doing this, because I really didn't want to bash heads. That's not why I came into law enforcement. I want to help people. And that's what they're doing. And they have such job satisfaction. And they're working together. It's the health department, it's social services, it's law enforcement, and they're all kind of figuring out how to solve problems. Well, now you can see that this is set up. So what's going to happen? They're not going to be siloed anymore, you know, if they have anything to do with it, because they're going to keep growing and figuring out, well, what should a response to this kind of crisis look like? And how can that be put in place? Because we're going to have other crises like this. So so that's what's happening, you know, in little pockets all over the country. And that's what we want to uplift and, you know, and provide structure and strategy and things like that so that people can do this quickly and help each other as we go along. Most of the local violent incidents, as probably most of you all know, is domestic violence, but it's hardly ever reported. And yet that's what costs the community the most, the ripple effect from that. And I mean, like a lot, like, you know, maybe a third to half of your emergency response goes to the dealing with domestic violence. The domestic violence community has done a really great job of reaching out to survivors and providing a lot of services there. But the prevention piece is with the batterers, because when a batterer or when a person escapes a batterer, that batterer just looks for another victim. And in California, they have poured, I don't know, hundreds of millions of dollars into domestic violence prevention, mostly going through the victims. And it has not moved the needle in 10 years, has not moved the needle in 10 years. And that's because the batterers, who are half of this equation, were saying, okay, you're the bad guys, mostly guys, you're the bad guys, so you're going to be moved out, and we're going to treat you despicably and expect you to improve. And there's really, there long and arduous batter intervention courses that batters take, anywhere from 6 weeks to a year, to avoid going to jail. But they start out with tell this group what bad thing you did to get you in prison, or get you a jail sentence and have you come to this, and then watching horrible videos. And so how is that going to someone who has an ACE score of, how's that going to help someone who has an ACE score of 8 or 9 or 10. You know, it's not. So there are a small handful of people who are saying, who know about this, who are integrating this. But because a community could, I fully believe, decrease domestic violence in their community by taking this approach, you know, by 75% in 5 years, no problem.
I think just, you know, in terms of child welfare, right? So that's where part of the challenge is the siloing in those efforts. And so when you stop and think of the two sectors that have the greatest intersection with, you know, communities that are highly impacted by adversity, child welfare, education, right, have a huge footprint and opportunity for engagement. Then juvenile justice and the justice system, right? So those four sectors, those four systems, if we could really concentrate on supporting those systems in terms of integrating and adapting this approach, we can see a huge collective impact in the kinds of outcomes that we see in communities, right? And the challenge is that we also simultaneously need to address the legislative and those limiting structures that hobble a lot of those practitioners within those systems, right? So that's the chicken egg issue. Like, where do we start first? The legislation? And the answer is yes, start, right? But we do have to engage at that macro level. And I think what the program that and the opportunity for the cooperative and collecting data is because now we are speaking the language of those legislative bodies. And if we can translate that data into cost savings and fiscal impact, as well as the bring alongside the stories of impact, I think that's where we see the needle move in those sectors, is when we can bring that quantitative fiscal data that talks about the cost savings and impact, along with the qualitative stories of transformed lives of communities. I believe we can start to see some of that. And I think PACE's connection provides a great opportunity to bring those pieces together. And so that's why I'm here, because I believe so much in what the broader work and the movement that Jane and her team at PACE is doing. So again, appreciate the work that you guys do, Jane.
And we believe in you, Brian. You're doing great work there. Thank you all so much. I really appreciate meeting you and seeing you and your participation.
It was a joy being here. Thank you.